Hello everyone, this is Atharva Parchure. Today, let's go through the functional analysis of rectus femoris, a part of quadriceps muscles in yogasanas. First, in Utkatasana or the chair pose, it acts as an agonist by contracting to flex the knees as well as the hip joint. This could be seen from the diagram. Second, in Adhomukha Svanasana or downward facing dog pose, it acts as synergist for the flexion of hip joint by helping the prime flexors in the same region as shown in the diagram through highlighter. Third, in Dhanurasana or the bow pose, it acts as an antagonist by relaxing and stretching to maintain an arched shape of the body. This could also be seen through the diagram. And that's how we integrate Rachana Sharira in daily life. Thank you.
From anatomy to application, exploring muscle function. Functional analysis of quadriceps femoris across the three yogasanas. Muscle quadriceps femoris. The first pose is Utkasana or chair pose, in which quads, being the main movers, are agonist. It contracts eccentrically, controlling the knee flexion against the gravity. The next pose is Uttanasana, also known as the forward bend pose. Here quads acts as antagonists. The main movers are spinal extensors, piriformis, hamstrings and gastrocnemius. It maintains the pose by eccentrically lengthening, allowing the forward fold. The next pose is Trikonasana, also known as the triangle pose. Here it works as a synergist. The main movers are gluteus medius, tensor fascia lata, piriformis and sartorius. Quads assist the main movers through extension and stabilization of the knee joint.
From anatomy to application, exploring muscle function. In this video, I'll be explaining the functional analysis of latissimus dorsi muscle across the three yogasanas. The first one is Lolasana. Here, the latissimus dorsi helps in shoulder extension and supports lifting the body. Here, the latissimus dorsi muscle acts as agonistic. The second one is Vasishthasana. Here the latissimus dorsi muscles stabilizes the trunk and shoulder, also gives lateral stability. It works along with other muscles as synergist. The next one is Urdhva Here the arms are elevated above the head as shown, and latissimus dorsi acts as antagonistic, opposing shoulder flexion and abduction.
Greetings. Let us know the functional analysis of adductor longus across three yogasanas. Functional role in lengthening in the lifted leg, tilting the pubis and holding leg into position. Adductor longus acts as agonist in Vrikshasana. Functional role in lengthening in the lifted leg, maintaining pelvic stability and alignment, controls excessive abduction and prevents overstretching. Adductor longus acts as antagonist in Utthita Trikonasana. Functional role in assisting hip flexion, contributes to inner thigh engagement, helps stabilize the wide stance, prevents excessive lateral deviation. Adductor longus acts as synergist in Virbhadrasana first.
Hello everyone. Today we will have a look at the functional analysis of rectus abdominis muscle across three different yogasanas. The first one is the Navasana, wherein the rectus abdominis acts as the agonist muscle in order to resist hyperextension of the lumbar spine. The second asana is the Ustrasana, in which the rectus abdominis acts as the antagonist muscle and thus helps to control the backward bend of the spine to prevent collapsing on the lumbar vertebrae. The third asana is the Virabhadrasana 3, in which the rectus abdominis acts as the synergist muscle along with the back extensor muscles to maintain the neutral position of the spine. Thank you for watching.
Bhujangasana, Cobra pose. Falakasana, plank pose. Third, Adho Mukho Swasana, downward dog.
I am going to introduce function of bicep brachii in the Chaturanga Dandasana, Falakasana and Gomukhasana.
1.
This is the Chaturanga Dandasana. Role of bicep brachii is to stabilize the body. This is the Gomukhasana. The role of bicep brachii is to opening the shoulders. This is the Falakasana. The role of bicep brachii is to stabilize the body.
One.
Thus, the main role of the bicep brachii is the stabilization in these three yogasanas. Thank you.
My name is Harsh Dhananjay Lale and I'm a student of 25-26 batch of Tilak Ayurved Mahavidyalaya. Today we are performing a functional analysis of pectoralis minor muscle across three asanas, that is Bhujangasana, Chaturanga Dandasana and Purvottanasana. So let's start with the first asana.
So Purvattanasana, it is also called as a upward plank pose, and it opens up the chest and stretches the pectoralis minor muscle, and it also improves the shoulder extension. In Bhujangasana, chest expands and shoulder moves backward. Here, the pectoralis minor muscle helps in scapular stabilization. In Chaturanga Dandasana, the body holds parallel to the ground. Here, the pectoralis minor muscle stabilizes the scapula against the thoracic wall.
Anatomy to application, exploring muscle function, functional analysis of rectus femoris. Origin anterior inferior lilac spine, insertion base of patella, nerve supply femoral nerve, blood supply descending branch of lateral circumflex femoral artery. Asana 1 Veerbhadrasana. Knee extension stabilizes the front leg position by managing extension of knee. Asana 2 Utkatasana. Key muscle stabilizes the knee in half squat position by helping strengthen them. Asana 3 Navasana. Assist in the help flexion to lift legs and maintain core balance. Applied anatomy. Difficulty in hip flexion and knee extension, mostly injured during sports.
Everyone, my name is Odar Govardhan, first year BNS student, batch 2025-26 of Tilak Ayurved Mahavidyalaya, Pune. So I am here to perform functional analysis of pectoralis minor across three yogasana, Bhujangasana, Falakasana, Purvottanasana. So let's start with the first asana, Bhujangasana. In Bhujangasana, chest expand, shoulder move backward, and pectoralis minor help in scapular stabilization and assist in lift rib cage during deep breathing. In Purvottanasana, it improves shoulder extension, strong stretch of anterior chest muscle, open chest and stretches pectoralis minor. In Falakasana, it support in weight bearing, prevention of shoulder collapse, distribute load and maintain shoulder stability.
From anatomy to application, exploring muscle function, functional analysis of internal oblique muscle, origin thoracolumbar fascia, anterior to third of iliac crest and lateral half of inguinal ligament, insertion inferior border of 10 to 12 ribs, linea alba and pubic crest, nerve supply lower 6 thoracic nerve and first lumbar nerve, blood supply lower intercostal artery, subcostal artery and branches of deep circumflex iliac artery. Asana 1 Bhujangasana opposes trunk extension by controlling and stabilizing abdominal wall. Asana 2 Trikonasana assists in lateral flexion and rotation of the trunk along with other abdominal muscles. Asana 3 Navasana helps in trunk flexion and stabilizes core while balancing body in V shape. Lead anatomy weakness of internal oblique leads to poor core stability and lower back pain.
Jaydeep Pramod Chaudhary. I am going to introduce Gomukhasan, Garudasan and Chaturanga Dandasan and explain the role of deltoid muscle in these three asanas. This is Gomukhasan. In this asana, anterior and lateral deltoid muscle are fully stretched. This is Garudasan. In this asana, lateral deltoid muscle works to lift the elbow away from the chest. Anterior deltoid are in this action. The role of deltoid muscle are essential in Gomukhasan, Garudasan and Chaturanga Dandasan. Thank you.
My name is Ataf Babu Sheikh, studying in Tilak Ayurved Mahavidyalaya, Pune. Today, we are performing functional analysis of brachioradialis muscle across the three asanas. First one is a Chaturanga Dandasana, second is a Paschim Namaskara Asana, and third is a Falakasana. In Chaturanga Dandasana, core stabilization, body alignment training, upper body strength development. In Falakasana, isometric elbow stabilization, support neutral forearm activation, build grip and wrist support strength. In Paschim Namaskara Asana, shoulder mobility, chest expansion, wrist flexibility.
Today I will demonstrate three yogasana, Bhujangasana, Urdhvasana and Adho Mukha Shavasana and explain the role of rhomboid major in it. In this asana, rhomboid major helps retract the scapula, pulling the shoulder blade toward the spine. Adho Mukha Shavasana. In this asana, rhomboid major stabilizes the scapula and controls the shoulder movement. In this asana, arm lift upward and rhomboid major stabilizes the shoulder blade. In this three yogasana, we learn rhomboid major muscle help in scapular stability and shoulder alignment. Thank you.
My name is Vaibhav Dudmaski, first year BMS student of 2025-26 batch of Tilak Ayurved Mahavidyalaya, Pune. Today I will be explain about the functional analysis of the latissimus dorsi muscles across the three asanas. First one is Bhujanasana, second one is Dhanurasana, and third one is Adho Mukha Shavasana. Yogasana, latissimus dorsi contract to assist in a trunk lifting, help in a shoulder extension and stabilization, work with a erector spine.
asana, strong concentric construction of latissimus dorsi, assists in pulling arms backwards, helps in a chest expansion. In Adho Mukha Swasana, latissimus dorsi act eccentrically, stabilize shoulder joint, provide control, stress to back muscle.
Hello everyone, in this video we are exploring the functional analysis of bicep femoris across three yogasanas. The first one is Virabhadrasana 2. In this yogasana, bicep femoris laterally rotate the tibia when the knee is flexed and also act as a stabilizer on the lateral side of the knee as shown in the figure. The second yogasana is Virabhadrasana 1, where in the back leg hamstrings works to extend the hip and stabilize the knee, while the medial hamstrings are particularly active in maintaining the internal rotation of the back hip, while bicep femoris act as a synergist for overall hip extension as shown in the figure. The third yogasana is Utkatasana or chair pose, where bicep femoris act as a crucial stabilizer, relaxes and lengthens, allowing knee flexion. Together with other hamstrings, it also maintain pelvic stability, balancing the intense engagement of the quadricep. Thank you.
Hello, my name is Hemant Deshmukh and I am going to perform the role of trapezius in Salabhasan, Garudasan and Gomukhasan. The first one is Gomukhasan. In these asanas, the upper trapezius helps to elevate the shoulder blade and lower trapezius helps to depress the shoulder blade. This is the asana. Asana is Garudasana. In this asana, the upper trapezius helps to lift the elbow and the middle trapezius stretches across the back. This is the asana. The third asana is Salabhasana. In this asana, the upper trapezius help the neck to be in line with the spine and the lower and middle trapezius retract and depresses the shoulder blade. The following is this asana.
First asana is the Gomukhasana. Cow face pose is a seated yoga asana known for being one of the best opener for the hips and the shoulder. Role in asana 1 Gomukhasana. In the upper arm, it performs external rotation to help the hand reach behind the neck and down the back. Second asana is the Adho Mukha Shavasana, commonly known as the downward facing dog, is one of the most foundational and widely recognized posture in yoga. Functional role in asana to Adho Mukha Shavasana, it maintains the shoulder stability by preventing internal rotation of the humerus while the arms bear weight. Asana is a Bhujangasana, commonly known as a cobra pose, is a foundational reclining back bend in a hatha yoga. Functional role in asana 3 Bhujangasana, it helps in rolling the shoulder back and away from the ears, assisting the broadening the chest.
Role of coracobrachialis in Tadasana. In Tadasana, the coracobrachialis helps in shoulder flexion and maintains stability of arm. Functional role of coracobrachialis in Bhujangasana. In Bhujangasana, the shoulder moves into extension while lifting the chest. The muscle opposes the movement, so it acts as antagonist. Functional role of coracobrachialis in Falakasana. In Falakasana, the arm supports body weight. The coracobrachialis assists other muscles in stabilizing the shoulder joint, so it acts as synergist.
Hi ma'am, my name is Pankaj Sudham Padvi, roll number 85. I got gluteus medius muscle. There are 3 yogasanas in these muscle participate. First is Rukshasana, second is Ardha Chandrasana, third is Garudasana. Rukshasana in this yoga, gluteus medius muscle roll in abduction, external rotation, pelvic stability and abductor support. Yoga is Ardha Chandrasana. In this yoga, gluteus medius muscle roll in pelvic stabilization, hip abduction, pelvic rotation and knee tracking. Third is Garudasana. In this yoga, gluteus medius muscle is roll in pelvic stabilization, hip abduction, joint stabilization and internal rotation.
Hi, hello madam, my name is Dinesh Dhima Padvi, roll number 84, Department of Rachana Sharira, periodical assessment 4. First, function analyzing of 3 yogasan. First, Vasisthasana, second Parigasana, third Parasvagasana. First yogasan, Vasisthasana, means by top leg controlling the rotation and rule of pelvic leveling of frontal plane on bottom legs of bearing of stability. Second yogasana, Parigasana, means by kneeling lengths anti-sago stability and contact of isometrics. Second point, extend lengths of joint guarded internal rotation. Third point, contracts of fronts and fiber of glute minimize internal rotation. Third yogasana, Parasvagasana, means by front bend lengths anti-polar stability isometric abductor. Second point, joint of controlling glute minimum.
Thank you.
Hello everyone, today we are going to demonstrate the yoga asanas involving the external oblique muscle. The first yoga asana involving the external oblique muscle is the side plank pose, which is also known as Vasishthasana. In side plank pose or Vasishthasana, the functional role of the external oblique muscle includes the following: lateral stabilization, anti-rotation, pelvic elevations bottom side, isometric contraction top side and spinal support. In gate pose, Parigasana, the functional role of external oblique muscle includes the following: lengthening and stretching top side, active engagement and strengthening bottom side, spinal stabilization, rotational control and breathing expansion. In side angle pose, Parshavokasana, the functional role of the external oblique muscle includes the following: contralateral rotation top side, ipsilateral side bending bottom side, stabilization of the core, lengthening the top side, stabilization of torso, rotating the rib cage upwards and creating the lateral expansion.
Origin of supraspinatus muscle is supraspinatus fossa of the scapula and insertion superior facet of the greater tubercle of humerus. First asana is Vrikshasana. Its functional role is initiate and maintain adaptation of arm as hands move overhead. Second asana is Adho Mukha Shavasana. Its stabilizer pulls humeral head into glenoid cavity to prevent subluxation. Third asana is Trikosana. Its work with deltoid to maintain torque arm into stable adapted position.
Biceps femoris, a two-headed hamstring muscle, originates from ischial tuberosity and linea aspera, inserts on head of fibula. In Supta Padangusthasana, the biceps femoris acts as antagonist. It lengthens to permit the leg raise. In Virabhadrasana 3, the biceps femoris acts as agonist. It contracts to extend the hip. In Utkatasana, the biceps femoris acts as synergist. It stabilizes hip and knee joints. 3 functional roles across 3 yogasana: antagonist, agonist, and synergist. Clinically, it is the most commonly strained hamstring. Perineal nerve injury causes foot drop.
In Chaturanga Dandasana, the brachialis acts as agonist. It flexes the elbow to hold the body low in the plank position. In Bhujangasana, or cobra pose, the brachialis acts as antagonist. As the arms press down to extend the elbows and lift the chest, the brachialis must lengthen to allow this extension. In plank pose, the brachialis acts as synergist. While the triceps hold the arms straight as primary movers, the brachialis stabilizes the elbow joint, preventing hyperextension.
In Garudasana, when you lift your elbows to shoulder height, the elevator scapula acts as a primary elevator of the scapula. Functional role in Balasana, reaching the arms overhead causes the shoulder blades to move away from spine upward, and this gently pulls on the insertion point of the levator scapula. Functional role in Gomukhasana, the levator scapula acts as a primary levator, helps move to superior angle of the scapula forward. Thank you for watching.
Muscles are classified by fiber arrangement. The deltoid is a multi-pinnate muscle. 3 types: cardiac, skeletal, and smooth. Deltoid is a skeletal muscle. Deltoid has 3 heads: anterior, medial, and posterior. In Tadasana, deltoid acts as antagonist. It stretches to support arm movement. In Virabhadrasana, deltoid acts as agonist. It contracts to hold arms raised. In Tadasana, deltoid acts as antagonist. It stretches to support arm movement.
Muscle name adductor magnus. Origin arising from the inferior pubic ramus. Insertion the adductor part inserts along the gluteal tuberosity. Nerve supply obturator nerve L2 L4. Hamstring part tibial division of sciatic nerve. Blood supply obturator artery. Profunda femoris artery. Asan 1 Tadasan assist in maintaining neural hip alignment and support postural stability. Asan second Garudasan tight in creates and tightly adduct thighs all the balance. Asan third Virabhyasana assists hip stabilization of both limbs by working with gluteal muscles to control femoral posture.
Namaste. I will demonstrate the Tadasan, Bhujangasan and Adho Mukh Svanasana and explain the function of this supinator muscle in these three asanas. First, Tadasan. The supinator muscles helps in maintaining forearm alignment and stability. Second, Bhujangasan. The supinator muscle helps in stabilizing the forearm during the weight bearing through the hands. Adho Mukh Svanasana. In this asana, the supinator muscle play an important role in forearm stabilization and controlled supination. Thus, the supinator muscles mainly helps in supination, forearm stability, and upper limb alignment during these yogasanas. Thank you.
Hi, today I will demonstrate three yoga poses: Paripurita Utkasana, Ardha Matsyendra Asana, and Vasishtha Asana, focusing on the role of internal oblique muscle.
In this asana, the internal oblique help rotate the torso and stabilize the core. These muscles support spinal twisting and maintain balance while we hold the posture. In this asana, the internal oblique contract to deepen the spinal twist. They also assist in compressing the abdominal organ, which can support digestion and improve core strength. In this asana, the internal oblique work to stabilize the torso and keep the body aligned. They play a key role in lateral flexion and maintaining balance.
Internal oblique muscles are essential for twisting, side bending, and core stability in yoga poses. Thank you.
Hello everyone, myself Madhur Nishikant Depura, first year BMS student studying in Tilak Ayurved Mahavidyalaya, Pune. Today I am performing function analysis of supraspinatus muscle across three yogasanas. First is Tadasanas, second is Virabhadrasanas, and third is Adho Mukha Savasana.
First asana is Tadasanas. In this, supraspinatus helps in shoulder joint stabilization, postural alignment, and synergistic support. Second asana is Virabhadrasanas. In this, supraspinatus muscles helps in initiation of shoulder abduction, stabilization of glenohumeral joint, and maintaining arm position. Third asana is Adho Mukha Savasanas. In this, supraspinatus helps in stabilization of glenohumeral joint, prevention of inferior displacement, and maintaining shoulder alignment.
Functional role of rhomboid major muscle in Bhujangasana. While doing Bhujangasana, the muscle pulls the scapula medially and helps in the chest expansion. Functional role of rhomboid major muscle in Gomukhasana. Rhomboid major muscle assists in keeping spine erect, and it also prevents rounding of the shoulder. Functional role of the rhomboid major muscle in Dhanurasana. While doing Dhanurasana, rhomboid major muscle keeps shoulder back during the pose, and it also enhances the back bend.
Functional role of subscapularis muscle in Bhujangasana. Bhujangasana helps stabilize the shoulder joint and control arms movement while lifting the upper body. Functional role of subscapularis muscle in Phalakasana. Phalakasana maintains shoulder stability and provides strength by internally rotating the arms. Functional role of subscapularis muscle in Adho Mukha Svanasana. Adho Mukha Svanasana assists in shoulder stability and internal rotation.
Functional role of Parvati Trikonasana is acting as a primary driver of spinal twist and a critical stabilizer for a core and spine. Functional role of Ardha Machindrasana in internal oblique muscle is as active rotator and stabilizer. The primary role of Vaisishtasana is stabilize the spine and pelvis.
Hello everyone, myself Kishan Sabandere. I am studying BMS first year 25-26 Tilak Ayurved Mahavidyalaya, Pune. Today I am performing the functional analysis of subscapularis muscle across three yogasanas. First is Bhujangasana, second is Adho Mukha Svanasana, and third is Utkatasana. First asana is Bhujangasana. Subscapularis helps in chest expands and assist in lifting ribcage during deep breathing. Second asana is Adho Mukha Savasana. Subscapularis helps in medial internal rotation of shoulder joint and prevent excessive external rotation. Asana is Utkatasana. Subscapularis helps in shoulder joint stability and internal rotation of humerus.
Hello, good morning everybody. Today I am going to demonstrate various asanas. My asanas are Garudasana, Ardha Chandrasana and Varishta Asana. And I am also going to tell the role of gluteus medius in these asanas. The Garudasana. In this, the gluteus medius muscle is helping the pelvis for stabilization.
1.
Now I am performing Ardha Chandra Asana. In this, my right leg will be standing. In Ardha Chandrasana, the pelvic acts as a major stabilizer for standing position. Now I am performing Vasishta Asana. In this also, the gluteus medius muscle is acting as a major stabilizing muscle for the pelvis.
1.
Thus, the gluteus medius muscle is majorly act as a stabilizing muscle for the pelvic region.
Hi, today I will demonstrate three yoga poses: Paripurita Utkasana, Ardha Matsyendra Asana and Vasishtha Asana, focusing on the role of internal oblique muscle.
In this asana, the internal oblique help rotate the torso and stabilize the core. These muscles support spinal twisting and maintain balance while we hold the posture. In this asana, the internal oblique contract to deepen the spinal twist. They also assist in compressing the abdominal organ, which can support digestion and improve core strength. In this asana, the internal oblique work to stabilize the torso and keep the body aligned. They play a key role in lateral flexion and maintaining balance.
The internal oblique muscle are essential for twisting, side bending and core stability in yoga poses. Thank you.
Asana, Gomukasana. Functional role of Gomukasana is to relieve stiffness in the shoulder, neck, upper back, and it also strengthens the spine and reduces stress. Second asana is reverse namaste. The functional role of reverse namaste asana is the encourages an erect spine when practiced in mountain pose, acts as chest opener and reduces anxiety and tension. Third asana is Trikonasana. The functional role of Trikonasana is to strengthen ankles, knees, thighs, and calves. Twisting motion, lateral bend helps stimulate abdominal organ, reduces issues like constipation.
This muscle is vastus intermedius. The primary function is knee extension, postural stabilization, control of knee flexion. This asana is called Tadasana. Vastus intermedius plays role of agonist. It keeps knee fully extended and preventing knee flexion, thus helping in upright posture. Next is Balasana. Vastus intermedius play role of antagonist. It helps by relaxing and lengthening to allow knee flexion. So it opposes quadriceps action, so it relaxes. Next is Vrikshasana. Vastus intermedius play role of synergist. Act as stabilizer by assisting quadriceps in maintaining knee extension and support to standing leg. It prevents wobbling and bending. Thank you.
Functional analysis of latissimus dorsi muscle. Origin is spinous process T7 to T3 vertebra. Insertion floor of intertubercle circles of humerus and nerve supplies thoracodorsal nerve is the branch of posterior cord of brachial plexus and blood supplies thoracodorsal artery. Balasana. It's provide a gentle stretch of spine, relaxes paraspinal muscles. Ardha Chakrasana. It produces lateral flexion of spine and stretches waist. Utkasana strengthens quadriceps and expands chest cavity, improves cardiovascular endurance.
Functional role of tibialis anterior muscle in Dandasana is to actively flexes the foot and prevent feet from flipping outwards.
Functional role of tibialis anterior muscle in Tadasana is to lift the inner arc of the foot to maintain alignment and balance. Functional role of tibialis anterior muscle in Vajrasana is to lengthen the feet and prevent from rolling out of ankle.
Anatomy to application, exploring muscle function. Hello all, today in this video I am going to explain functional analysis of hamstring muscle across 3 yogasana. First is Setu Bandha Sarvangasana. In this, hamstring muscles function to extend hip and stabilize knee. Second is Uttanasana. In this, it functions antagonist to quadricep and maintains stability in this pose. Third is Virabhadrasana. In this, it functions synergistic to gluteus maximus muscle and maintain lower body stability. Thank you.